One of the hardest things right now is being able to wash your hands on the Navajo Nation. If you don't have hot and cold running water and access to soap, that's extremely difficult. And as we've all heard throughout the past weeks, that's one of the ways to flatten the curve the most. In addition to that, not having drinking water on the reservation is very difficult because when you need access to running water, you need to actually get bottled water and travel to these different grocery stores. And a lot of times when residents arrive, there just isn't any left.
You run the Navajo Water Project, as we said before, the mutual aid that's going on, and also why the Navajo community is so hard hit, a hot spot in not only in places like New Mexico and Arizona, but in Indian country overall.
Yeah, that's such a great question because the Navajo Nation experiences some of the highest rates of water poverty in the United States. Navajos are 67 times more likely to not have indoor plumbing and potable water and sanitation in their homes. And again, getting back to the idea of not being able to wash your hands, you're not able to flatten the curve then. And we've seen a rise of COVID cases when that happens. As I mentioned, when people go out to haul water, whether that's from stores or watering points, they're also exposing themselves to others. I think it's also been really tough because we don't have a ton of health facilities across the reservation, and those that do have access to it often live very far away and aren't able to get there in time.
And can you talk about the role of Navajo women in leading mutual aid?
Yeah, I'm glad that you asked that question. I think I've seen many Navajo women step up and fight for our communities, which is our traditional role. That's not to say that we're in the 60s and it's the idea of stay in the kitchen. It's that we are the caretakers of our communities. And this is nothing new for us. It's time to step up and work together and just make it happen where people are able to get the help that they need and to really just come back and serve our communities. I think of this as by Navajos, for Navajos, of projects that are happening on the reservation successfully.
And now the chairman of the Navajo Nation, Jonathan Nez, and the vice president, he's the president, currently in quarantine?
Yes, that's correct. They do believe that they could have come in contact with COVID themselves.
And the hospitals and clinics on the reservation, are they adequate? And what do you think needs to happen at the national level in the United States? We're talking stimulus package, the kind of aid that Indian country is getting from that it's obviously much more, $4-6 trillion stimulus package.
Yeah, so it's important to understand that on the Navajo Nation, we have two types of hospitals. One is IHS, or Indian Health Service, which is across Indian country. And then we have what are called 638 hospitals, which are hospitals that were originally part of the federal government, but have been taken over by the tribal government. And on the reservation, there are 16 health centers. 9 of those are clinics, 7 are hospitals. There are about 400 hospital beds across the nation and 46 ICU beds. Talking about these numbers, that is not proportionate at all. And it's scary to think about these numbers rising. And so, yes, we are a sovereign nation. Yes, we are able to help ourselves. But it's also important that we do have our treaties honored and have that funding from the federal government, because this is when we need help. Right now, we can't wait.